Cold open. Ever heard of hypodontia? It's a dental condition where one or more teeth fail to develop. It can affect both baby and permanent teeth, but it's more common with the latter. The most affected? Wisdom teeth, followed by second premolars and upper lateral incisors. But remember folks, any tooth can be affected. It can be an isolated case or part of a syndrome with other developmental abnormalities. What causes hypodontia? Well, it's complicated. It can be genetic, environmental, or a mix of both. Severity varies too. Some might have one missing tooth, others might have more. Treatment is based on the number and location of missing teeth and their impact on oral function and aesthetics. Orthodontic treatment, dental prosthetics, and other dental interventions can all be part of the solution. If you suspect hypodontia, or it's identified during a dental exam, consult with a dentist or orthodontist to discuss your options. Spread the word, comment your thoughts, give us a like, and don't forget to subscribe for more updates. Thank you!